Okay guys, so we're going to do a range of motion assessment or assessments for the elbow, radial ulnar and wrist joints. Okay, so we're basically going to run through these nice and quickly because they are pretty simple. Okay, some of the other joints like the shoulder and the hip are a little bit more complicated, but these joints, as you will know from learning about the anatomy, are a little bit simpler in terms of the movements that are available at them. So first things first, when we're looking at these joints, we're thinking about the elbow joint. What does the elbow joint do? It pretty much just flexes and extends. It's a very basic joint, and that's why a lot of the exercises that we choose, for example, like tricep exercises, it's really just a case of pushing down, you know, a lot of the time when we're talking about training. So you got flexion where the hand comes up towards the shoulder and extension where you straighten the arm again. So if you can do from the side here, Paddy, getting the triceps out, what you can see here is that when Paddy gets down to the bottom, he's got a nice straight arm, he's got full extension of the arm. Now, I've had clients where when you look at their active range of motion that they have available, it's short. It's like that, you know, that they're not getting any further than that, okay? And that's especially the case if someone has potentially some sort of history of fracture around the elbow, okay? If they've had a history of fracture or something like that. I actually used to live with a guy who had, I'll actually discuss that in a moment in more detail, forget about that for a second, right? So basically, if someone has a short range of motion like that, then again, what are you thinking? You're thinking that this person probably isn't going to be able to lock out fully on a bench press or on a dip. So again, that might have implications. It might also tell you that if that person is doing some sort of bicep curl, that they're not going to be able to get down fully into that stretch position because they don't have that range of motion available, okay? So again, that's something that you can spot easily if you just have a look at how someone is moving. Generally, someone's going to be able to flex up the whole way. That's unlikely to be limited because the main limitation to movement there is that your big old biceps get in the way. To be honest, even if you don't have big biceps, the main limitation there tends to be kind of soft tissue related. You get soft tissue contact as you flex the elbow up, whereas when you actually extend the elbow, it's more so the bony contact there at the back of the elbow joint that leads to the end range of motion. So it's more so a hard end feel, as you say. So yeah, that's the elbow joint. It's pretty simple in terms of the flexion and extension stuff. You don't have to think too much about it. You know, where it does become a little bit more complicated is when you start to think about bringing in pronation and supination as well. So for this, could you sit forward for me, Paddy? So remember, I said that the elbow joint is a pretty simple joint in that it basically just flexes and extends. But sometimes in exercise, we actually add an extra element of complexity to that by adding pronation and supination. Now, the reason I say that that's not the elbow joint is because pronation, meaning palm towards the floor, and supination, meaning palm towards the ceiling, that's actually here at the radial ulnar joint. So you have your proximal radial ulnar joint and you have your distal radial ulnar joint. So that's the movement between the two bones, the radius and the ulna, there in the forearm, that creates that movement. So that's actually not technically taking place at the elbow, but it still is involved in a lot of the elbow exercises that we do. And as I mentioned a moment ago, I actually used to live with a guy who, when he put his two hands out in front, if you do that for me, he literally, if you try and supinate, so supinate all the way, he probably had that much on his right hand and absolutely no further. Like, it wasn't going further. Even if you moved it passively, it was totally fixed, okay? And that's always been an eye-opening moment for me because, you know, as personal trainers, we often just assume that everyone that comes in is just like us, you know? It's like, yeah, just go kind of full round, full range of motion, and that's gonna be fine. You know, everyone can do the same types of exercises. So someone could give him a program and say, yeah, I want you to do a chin-up where both his hands are under the bar, but he's genuinely not going to be able to put his hands on the bar in that fashion. It's not going to be possible, okay? And if he does manage to basically force his way in, it's going to be through additional compensation at the elbow joint and at the shoulder joint or movement of the body, and that's just adjusting the training stimulus that we're trying to apply. So that's why it's important to be aware of this stuff, because if you have that individual coming in, that is an individual client just like any other client that's coming to work with you. And if you have that in your arsenal to be able to say, okay, I see where the range of motion restriction is, then you can say to that client, no problem, we're going to do chin-ups, but we're actually going to do chin-ups on the rings, or we're going to do neutral grip chin-ups, you know, that you've got other things in your arsenal because you're able to identify these changes in range of motion. So, as I said, if you put the hands out in front for me again, Paddy, basically pronation is where the hands come down towards the floor. Supination is up towards the ceiling. So think about how that relates to exercise, because they're actually very practical things. So if someone does not have much supination, then we might want them to use a different type of bar. So for example, if he can't come all the way up, but he can get as far as there, then maybe if we're doing some sort of barbell curl, instead of using a straight barbell curl, we might use the easy bar curl because there's an angle on it, you know, or we might just use dumbbells because we've got freedom of movement. So that's something that you actually might take a look at. If someone is saying, you know, hey Gary, every time I do bicep curls, my elbows are always at me. You know, they're just always driving me mad. It never feels good. Then that's something that might actually be relevant in that context, because you might say, hey, I wonder if you're just forcing yourself into a position that's quite uncomfortable, okay? That's just not really available, because that's what you'll see is that if you do that again, Paddy, where you're kind of forcing it, he basically has to kind of jam his elbow in. He needs to rotate his shoulder a bit to be able to get the hand into that position. And if you try and do that on both sides, it's actually quite awkward then, because like you can't really get yourself into that position very comfortably if the range of motion isn't available. So they're the things that are just worth being aware of. And the same thing applies to pronation. So if you're doing some sort of pronation exercise, such as a barbell row, for example, and you're trying to keep your elbows right in by your sides, that's actually quite difficult. Even if you have a lot of pronation range of motion, it's still difficult to hold that position. And I can feel like there's a lot more going on there at the elbow than if I was just kind of leaving my hands like that. Okay, so if you're getting someone to do an overhand row of some sorts, then if someone is saying, you know, I actually just feel that my elbows are the limiting factor when I do an exercise like that, then it might be the case that you say, you know what, let's have a look at the range of motion, and next thing you see that they can only get that far normally, and the rest of that is forced and held in place by the bar, then that might be a case at which you intervene and say, you know what, why don't we do a seated row variation where you use handles that are freely movable, or where you use something like a neutral grip where the thumbs are facing towards the ceiling essentially. So they're the types of things that you can start to apply here from using this very basic information of a 2-second range of motion assessment. Because literally all I'm saying is, hey Paddy, could you put your palms towards the ceiling, palms towards the floor, boom, done. Like that's done. That's something you can say to a client 1 minute before they do an exercise, and you can just make an adjustment as needed. It doesn't have to be a big complex process, okay? Now, from there, from the radial ulnar joint, the next thing is to have a look at the wrist joint, okay? The wrist joint is pretty simple, okay? Because you don't need to go into too much detail here. Basically, you just need to have a look at flexion and extension primarily. So if we look at wrist flexion, that's basically going to be, Paddy, palm towards the ceiling for me, and if you bring your hand up towards your forearm. Okay, you're basically just looking at the person, bringing their hand up towards themselves and seeing the wrist flexion that's available. Now, it's very common for people to have had some sort of wrist injury, like a Colles fracture or some sort of other fracture of the wrist in the past that could potentially be limiting their wrist range of motion. Okay, now the good thing is, you can rest that down again, the good thing is that in most cases, we're not doing many wrist flexion exercises in the gym. If you are doing something like a wrist curl to try and build up your forearm strength, then that might be relevant there. How much range of motion does someone have available? Because if they got a history of wrist injury and they don't have much active movement there at all, then it might be the case that, like, you know, that's just not a great exercise for them, or you might have to do a different type of exercise, or even just customize it to a very small range of motion. What is a bit more relevant and probably comes up a little bit more often is wrist extension. So if you put palm towards the floor this time, just for the sake of seeing it, and then bring it up towards the ceiling. Again, we're looking at the arm, making sure that's straight. As he brings that up, if I see that he's barely able to move that at all, sometimes where that can actually be relevant is in something like a push-up, for example. So you can rest it down. If someone is doing push-ups, then a lot of the time it actually requires them to do basically 90 degrees of wrist extension. So if you're thinking about what that entails, sometimes what someone will do is they'll move their hands out a little bit, and sometimes they don't have to use as much of that range of motion. But a lot of the time you are using up to 75 to 90 degrees of wrist extension when you're doing a push-up. And if someone does have very little range of motion available, especially in that context again where you have an individual with a history of wrist fracture and as a result of reduction in range of motion, especially if it's that passive range of motion, then forcing the person into that position under their body weight mightn't be the wisest thing. And that's especially the case if you're doing something like a weighted push-up. So you can see how these things do start to become relevant, okay?